Today we're going to talk about lymphedema. Lymphedema is a buildup, an accumulation of lymphatic fluid that occurs when there's a blockage in the lymph system. Anytime anybody has had lymph nodes removed, which is typically the case with breast surgeries, there is a risk for lymphedema because the lymph nodes are a vital part of the lymphatic system. They function like drains or filters. They filter out the waste, the bacteria product of the lymph fluid. All the lymph fluid passes through the lymph nodes. So once lymph nodes are removed, again, as is the case with breast surgery, the person is now depending upon the lymph nodes in the surrounding area to be the filter for the system. If those lymph nodes do not keep up with that filtering, then that fluid is not going to be transported as normal, and there could be a blockage or a buildup where the fluid will start to expand out into the arm, causing swelling, which is lymphedema. With lymphedema, there is no time frame. So once somebody has had lymph nodes removed, lymphedema can occur days, weeks, months, even years later. We can't be sure who will or won't get lymphedema or the time frame, but we just know that with lymph node removal, there is a risk of lymphedema, and the more lymph nodes that are removed, the greater the chance of the lymphedema. That's why it is so important that you stay in contact with your doctor and let him know if you start noticing signs and symptoms, which we'll talk about those in a minute. Lymphedema is treatable. It's not curable, but if people develop lymphedema, you can seek treatment. Probably the most common routes of treatment are through outpatient therapy. Ideally, if you can see a lymphedema trained therapist, as well as compression garments. If you've not seen a compression garment, they are the garments. It's a sleeve that typically fits on the arm from down near the wrist all the way up to the high arm, and help put compression through the arm. Both outpatient therapy and the compression garment, though, are something that require a physician prescription. So that's why it's so vital that you stay in contact with your physician. If you look at your booklet, on page 3, we have a list of signs and symptoms. A lot of the signs and symptoms are just common sense, but we like to go over it just to kind of clarify some things. The first thing you're really looking for is swelling. You're looking for that retention of fluid. In the case where you've only had lymph nodes removed from one side, the other arm can be seen as your normal side. So if you start to believe you may have some swelling, it's always good to just do an arm-to-arm comparison and see if the size looks any different between the two arms. Also, with lymphedema, you'll notice decreased flexibility in that arm, decreased strength. Clothes that you typically wear, you may notice a tightness. Also, patients have described the arm as feeling very heavy, and the skin could even feel stretched. Typically, you just get a painful swelling in there. Also, be aware if you start having one or more episodes of infection, which you'll sometimes hear termed as cellulitis. The whole arm may swell with the lymphedema, but it can also be segmental. The hand is a very likely place because of that gravitational pull. The fluid likes to go downwards. Also, just the appearance of the skin in general. If you start noticing discoloring, purplish, frequent looking discolored skin, that's another sign or symptom. And lastly, but still important, is changes in your sensation, numbness, tingling. After surgery, it's very, very typical in that underarm area where they've taken lymph nodes from for that to be numb and tingly. Ideally, what happens as you heal is that starts improving. You start feeling more normal. Sometimes it won't go all the way back to normal, but it'll be more towards that normalcy. If all of a sudden you start experiencing increased numbing and tingling anywhere throughout the arm, that's another warning sign. So what we want you to do is contact your physician immediately. Just give them a quick call. Touch base, let them know your concerns. They may want to see you prior to your appointment, or they may just talk you through it on the phone. But lymphedema is something, if you believe that you're developing, you want to be proactive and get it treated right away. As we continue to go through our booklet, on page 4, we talk about lymphedema precautions. These are things that we believe will help decrease your chances of developing lymphedema. There are 10 steps listed there, and we're not going to cover them word for word, but the overall theme of all these steps are you need to keep that arm where the lymph nodes have been removed from clean and clear of an infection. So what that means is just good hygiene right off the bat. You need to take good care of your skin. If you're a person that tends to get dry, cracked, peeling skin, moisturize. It doesn't matter your choice of lotion, just something that helps you moisturize. We also want to prevent extra pokes, prods, and openings on that arm. So with that being said, you want to limit. You don't want them to do any sort of needle pokes, which would be like IVs, which would be blood draws, you giving blood, them taking your blood, or vaccinations, as well as blood pressures. Any of that stuff should now go to the side that you did not have surgery in. Stay off of that side that's had the lymph nodes removed. Continuing on with that, you've just had surgery across that breast area into the armpit. No heavy lifting. A general healing time is about 4 to 6 weeks, but remember, everybody's different. So over these first 4 to 6 weeks, we're going to tell you on that surgical side, very light lifting. We're going to give you a precaution of a half a gallon, which gives you a good idea for the kitchen, which is about 4 pounds, a little over 4 pounds. That just gives you a parameter to work within. However, if you're lifting something with that surgical side that you know is less than 4 pounds, and it hurts, or you have strain, pain, or just feel fatigued, you need to stop doing that. You listen to your body first. For all of those people that do home management tasks at home, you're going to have to take a little bit of a back seat on that over the next 4 to 6 weeks. We have things listed in here. They talk about avoiding repetitive, vigorous shoulder motions, typical home management tasks, vacuuming, sweeping, raking outside, even things like wiping down shower walls, mirrors, windows, things like that. None of that should be done during these first 4 to 6 weeks. We want that area to heal really good. None of those big shoulder repetitive motions right now. As you heal and you follow up with your physician, they'll give you guidance about when you can start lifting more weight and if they have a lifting limit in the future. But just follow their advice as you heal and you follow up with them. Other things, you don't want anything tight fitting on that surgical side. Really easy rule of thumb, when you move something, whether it's clothing or jewelry, you should not see an impression of where it's been. That usually means it's fitting a little too tight, cutting in on the circulation. Also, on your precaution page, you'll notice that we talk about airline travel. It's number 6. We have a lot of people in Florida that fly a lot. Some patients that have had lymph nodes removed notice swelling with the altitude change of the airplane. This is not an exact science. It doesn't happen to everyone. But speak with your physician about a compression garment if you do fly, because they may want to go ahead and order you one to wear for the plane flights. Other things, we do live in hot, sunny Florida. Avoid overexposure to the sun. It can cause sunburns with the dry, cracked, peeling skin, which is exactly what we don't want on that extremity. Also, watch out for bug bites. If you have to be out during peak bug time, insect repellent or spray. Also, a light cotton cover-up. When, and notice I said when, you get a cut or you get a bug bite, because it's going to happen, we just want you to be a little bit more protective of the skin now. Wash the area good with soap and water. If you have alcohol or peroxide, to disinfect the opening, and then keep something like an antiseptic ointment or spray, like polysporin, and just put it on the cut. It does not need to look like it's a massive wound to do that, but we are trying to prevent infection. Above all, remember that if you do have openings and cuts, redness, warmth, and swelling are usually the 3 signs that an infection is setting in. So if you notice any of that developing, please call your physician right away. That covers the precautions. We go on to the exercises. Oh, excuse me. First, we're going to briefly talk about tips after surgery. That's on page 5. These things are just things that we've noticed over time have helped our patients after having surgery. The physicians will tell you, the nursing staff will tell you, and we will tell you, when you are given permission to take a shower, that is exactly what they want you to do. As you're healing, they do not want you in a bathtub, hot tub, soaking any sort of pool of water. Also, you're going to have at least one drain that's going to be going home with you. Nursing will show you how to drain that and measure the drainage. From a therapy standpoint, we're going to remind you that that drain should always be secure. It is stitched in, but it also needs greater security than the stitches. So your physician prior may have given you a little camisole or a softie that has a pouch that you can stick it in. If you don't have that, if you noticed your drain, it looks like a little hand grenade with a nice thick loop on the top, you can take a safety pin through that loop and then you can easily pin it onto the inside of your shirt that you're wearing like that. For showering though, we don't want you to have to wear clothes in the shower, so what we recommend that you do is you get a long string. A shoelace actually works great because they're soft and long, and that same principle of where you have the drain and you have the nice thick loop at the top, you can take a string right through the loop and make yourself like a locket for a necklace, tie it around your neck, and that let the drain hang about down to your stomach area. I would always empty the drain prior to showering and then just cap it up, and you can just proceed with showering. All the drain is all plastic rubber material, so it will not hurt it to get some soap on it or to get wet. We also advise that you sit to shower initially. Some people may already have a shower seat or a bench built in. That's great. If not, you don't feel need like you have to go out and buy one. You can use a rigid plastic lawn chair. We just don't want patients right after surgery to have to stand up on one foot to reach down to the bottom of the other foot or have to bend all the way over. So a shower seat temporarily will be good. Also have supervision with your initial showers. That's real important just for safety. Also a pillow. Think about having a pillow. Sometimes the nursing staff may give you a little heart-shaped pillow while you're here, if we have those in stock. If not, use a pillow for home. Those work great when you're wearing a seatbelt in a car, to put that pillow right under the seatbelt so you still have the protection of the seatbelt for travel, but you don't have it cutting into your surgical sites. Pages 6 and 7 introduce exercises. These exercises you will begin today with me, as long as you haven't had any sort of reconstruction. The first page is real simple. It's just a series of breathing and neck exercises. The first one is just, you're sitting at the edge of the bed or a chair. You take a deep breath in through your nose and blow out your lips. What you should do as you practice that, you should have longer inhalations and exhalations so that you really feel that chest expand and release. I like to tell the patients you want to feel like Santa Claus when you fill it up, and then you want to blow it out and feel like you're really skinny again. So you're going to do that for 5 times, and this whole page is twice a day. Page 6 and 7 are going to be twice a day. Your next exercise is a chin curl, and you're just simply taking your chin and curling it down to either touch your chest or get it as close as possible, and you're going to count to 5 in a series of 1,000, 2,000, 3,000, 4,000, 5,000, and bring it back up. Each one of these exercises instructs you word for word on what to do. They also tell you to repeat it 5 to 10 repetitions. The following exercise involves a rotation. On this, you're not moving your shoulders, but you're simply turning your head as far as you can to one side and counting 1,000, 2,000, 3,000, 4,000, 5,000, back to the middle, and then over to the other side. 1,000, 2,000, 3,000, 4,000, 5,000, and to the middle. What I've just done on the neck rotations is 1 repetition, because you need to look to both the left and the right side, and you don't count until you get into place and can feel the stretch. Also, as you're doing them, it's very typical that you'll feel that stretch from the neck all the way to the breast, and that's okay. The final exercise on page 6 just involves a side bend of the neck. On this, you're not raising up your shoulders. You're simply tilting your head to the side as if you're trying to bring your earlobe down and touch the shoulder as far as you can go, counting 1,000, 2,000, 3,000, 4,000, 5,000, to the middle, and then the other side, 1,000, 2,000, 3,000, 4,000, 5,000, and to the middle. That, like the one prior, is you have to do it to the right and to the left, and that's 1 repetition. Then we go immediately to page 7. I like to tell you guys, look at page 6 and 7 as if they were one long program, because these are also going to be twice a day. On these, you are starting to get some more shoulder motions. Our precautions on these are move slowly and into what you can tolerate. You don't want to move really fast at big motions too quick, or you may feel a pull through that drain area. You should never feel as if somebody is stabbing where you have that drain or trying to pull it out. Okay, in that case, you've probably moved too fast, too big. The first one is just a shoulder shrug, and you're just going to raise your shoulders up towards your ears as high as you can get them When you're to the place that you can tolerate, you're going to count 5. 1,000, 2,000, 3,000, 4,000, 5,000, and slowly release them down. You're going to repeat that for 5 to 10 repetitions. Your next one, you're doing shoulder circles. The first is backwards. On this one, it's nice big shoulder rolls to the back. As you do them over time, they should get bigger. Right away, you may not tolerate the size of the rolls that I'm doing, but you're just going to roll back for 5 to 10 repetitions. Stop, take a little breather, and then roll forwards for 5 to 10 repetitions. Just like that. Be careful on the shoulder rolls. Notice what you're doing. You want to make sure you're rolling the shoulder and not the arms. A lot of people kind of do this little engine that could thing, and you're not getting the benefit to the shoulder. The final exercise on this page is you're going to be pinching your shoulder blades together like this. The picture in the book really doesn't show the arms helping out as much, but you can definitely use the arms to come in and help pinch. You pinch back as far as you can and you count 5. 1,000, 2,000, 3,000, 4,000, 5,000, and slowly release. I think it's helpful to think of putting a orange or a tennis ball between those shoulder blades, and it's like you're trying to hold it into place for that 5-second count. All of these exercises have pictures, the number of repetitions, so you can work at your pace, but working up to 10 repetitions, and both pages 6 and 7 will be done twice a day, every day, until the drain is removed. Alright, as you turn to page 8, you'll notice a warning sign at the top. These exercises we go over with you briefly, but these are not to be done until you have the drains out. If you get too big of a motion too early, you can actually get increased drainage, which can prolong how long that drain is in. So with that being said, let's talk about what we do want you to do with your arm as you're healing. Obviously, the exercises we've just done on pages 6 and 7, they're vital. Twice a day until the drain comes out. We also want you to begin to use that surgical arm in normal everyday tasks, such as feeding, when you fix your hair, when you take a shower. It's okay while the drains are in to raise your arms up to 90 degrees, which is about straight out in front of you or out to the side. By doing that, you can see with some elbow bend, that allows me to be able to fix my hair. I could wash my hair, I could style my hair. That also allows me to get dressed. When you're getting dressed, it's always easier to put that surgical side in first because it's going to be more sore. But over these first, which is about 2 weeks while those drains are in, limit the overhead reaching. What we like to tell you guys is about the top of your head is a safe range. And if that gets to be feeling uncomfortable or painful, then keep that at a limit as well. Now, after the drains are out, we want you to proceed with full motion, and that's what you'll see in these exercises. The first 2 exercises on the page involve you laying down. We recommend that you go home, you stretch out on your bed. The first one, if you could picture me laying down, it involves you raising your arms up above your head. You'll notice the goal is over time to get them all the way back over your head. If you could picture me laying down, I would be trying to touch my pillow or mattress. Now we know that after 2 weeks of not doing so much shoulder motion, it's not going to be that easy. So you just lift the arms as far as you can tolerate and hold it. Note also now you're holding it for 10 to 30 seconds, which is a long time, and we do want that 1,000, 2,000 count, and bringing it back down for 5 to 10 reps. The second exercise on the page involves you bringing your arms up and around. I like to liken this one to a snow angel. You're bringing your arms up, you're trying to bring them together up over your head. Again, picture me laying down. But if you're not able to get them up right away, that's okay. Take them as far as you can. Hold them for the 10 to 30 seconds, counting 1,000, 2,000, etc., and then bring them back down. And that's a 5 to 10 repetition count. The following 3 exercises involve you being up. We want to find a place in your house where you have a bare door or wall to stand beside. We'll use this one right here. Okay, so in this instant, you're going to clasp your hands like I'm doing and bring them behind your head. You're just going to stand against the wall and you're going to try to touch your elbows to the wall. They may not touch, but you'll press back as far as you can tolerate and you'll count that 10 to 30 second count, and then you'll release. And you'll repeat that for 5 repetitions. That one you only have to do 5 times. If you flip the page and go to page 9, we have 2 more exercises. These are typical. They've been around for a long, long time with mastectomies. Let's just say it was my left arm. This is my surgical side. I stand arm's length from the wall and I start walking my fingers up the wall. I either get to a point where I'm like, ooh, I feel a pretty good stretch there. I hold that for 10 to 30 seconds. I bring it back down. But over time, I'll be able to walk it further up the wall, and I'll start walking into the wall until I am pretty much kissing the wall, okay? And hold that for 10 to 30 seconds. For the next exercise, you're doing a sideways approach. So now we're going to pretend like it's my right arm. I start with it out to the side, and the same thing. I walk my fingers up the wall. I'm starting to get shoulder stretch right there. If I get to the point and I'm like, that's what I can tolerate, I hold that for 10 to 30 seconds. I bring it back down and I repeat it 5 to 10 repetitions. However, over time, this should get better and better, and you should be able to walk all the way up the wall and have your entire side next to the wall. Hold it for 10 to 30 seconds. Ideally, when you do these exercises, 4 to 6 weeks from surgery, you get full motion, or the motion you started with prior to surgery, back in your arms. We recommend that you do these until you get full motion back. And then I would say once you get them, don't just quit cold turkey. Do another 7 to 10 days. And then kind of look at your lifestyle or things you're doing around the house, or maybe you already have an exercise program, incorporating those big full shoulder motions. If so, then you're doing what you need to do. The rest of the booklet, we just give you information. Page 10 is our therapy department number. So if you get home and have any questions about this booklet, the phone number is right there. The page after that, 11, we give you some online resources for lymphedema. I always advise not to just Google lymphedema. Google likes to show all the bad stuff, but if you read these brief descriptions on page 11, you may want to go to those sites if you have questions that are pertinent to that information. And lastly, on page 12 is a vendor list. If you and the physician come to understanding that they do want you to get one of those compression sleeves, there are vendors with addresses so you can look at what's close to you. Do note at the beginning it talks about fitting compression garments. I would always recommend that if you do need a compression garment, that your arm be measured and it be fit specifically to your arm. You can get them over the counter, but you're going to have better results if you get them fit to your arm. If you should happen to develop some lymphedema prior to getting a garment, it would be great if you could see a therapist first, so they could work some of that swelling out and truly get that garment fit to the size of your arm. That takes us all the way through the booklet. On the cover page, you'll notice that we have Rebecca and Cecilia. They are our outpatient therapists here at Moffitt. They are both lymphedema certified therapists. They're excellent. So I would also highly recommend those guys as resources and contacts for you following breast surgery, especially if you have questions regarding lymphedema. Hopefully this has been helpful to you. Thanks.